Greetings and welcome to the discussion for Chapter 2, and this is from our textbook, Occupational Therapy in Community and Population Health Practice, 3rd edition. Today we're going to be discussing communication and population health concepts. So by the close of today's session, you should be able to discuss the rationale for occupational therapy participation in community and population health practice, identify the social determinants of health in a community, describe the contributions OT can make to achieve the goals of Healthy People 2020, describe the basic constructs associated with community and population health prevention and health promotion, discuss OT's role within the context of health promotion, community health practice, and population health practice. And then finally, you should be able to describe the community-centered practice framework and its application to community and population health. So let's get started. A vision for OT in community and population health is clearly supported by our Vision 2025 statement. The Vision 2025 states, occupational therapy maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. So as we look at that, keywords here, people, populations, communities, health, well-being. So, you don't get any more community-based, primary care-based, preventative-based than this statement here from Vision 2025. So the vision clearly supports our role in community and population health. Now I'd like to discuss key terms from this chapter. Social determinants of health include conditions into which a person is born. An example could include social, economic, and physical. These have an impact on the health, functioning, and the quality of life of the individual. Health disparities is defined as a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. And public health is defined as the critical functions of state and local health departments, such as preventing epidemics with infectious disease outbreaks, containing environmental hazards, example, exploring drinking water contamination, and encouraging healthy behaviors such as smoking cessation. Epidemiology is the study of the distribution, frequency, and determinants of disease, injury, and disability within human populations. Incidence is defined as the number of new cases of disease, injury, or disability within a specified time frame, typically within a year. Prevalence is defined as the total number of cases of disease, injury, or disability in a community, city, state, or nation existing at one point in time. And then risk factors are defined as precursors that increase an individual or population's vulnerability to developing a disease or disability or sustaining an injury. So support for community and population health is clearly comes from the World Health Organization, Healthy People 2020, Healthy People 2030, and the AOTA Vision Statement 2025. The Commission on Social Determinants of Health is defined by the World Health Organization, and there are several implementation strategies recommended by the World Health Organization. These include early child development, measurement and evidence, priority public health conditions, urbanization, women and gender equality, social exclusion, employment conditions, health systems, and globalization. Determinants of health include policymaking, social factors, health services, individual behavior, biology, and genetics. Healthy People 2020, they developed a framework, and this is a framework that helps you track the information from beginning to end. It's called MAP-IT, and the information regarding MAP-IT is within Chapter 2. This is a resource from Healthy People 2020 that helps us meet population health goals. So it begins with mobilizing, assessing, planning, implementing, and then finally tracking the data. As we explore approaches to community and population health, one approach is defined as a community health intervention. This is any combination of educational, social, and environmental supports for behavior conducive to health. An example for OT may include promoting safe driving with the CarFit program. Health promotion is the process of enabling people to increase control over and to improve their health. An example in this type of intervention is an OT designs a culturally appropriate materials for developmental milestones for recently resettled refugee families. Now let's explore the levels of prevention. Primary prevention is preventing the problems before the symptoms even occur. A way to do this would be an educational program for health professionals on the impact of alcohol-exposed pregnancies to help ensure women do not consume alcohol while pregnant. Secondary level of prevention is early identification of asymptomatic disease to initiate treatment or cure. So, in this example, an infant born with neonatal abstinence syndrome are identified in order to ensure referral to early intervention services. And then tertiary intervention is aimed at slowing the progression of the confirmed disease. So in this example, a child diagnosed with fetal alcohol syndrome receives school-based services and has a 504 plan. I think for most of us, we feel that we align with that tertiary level of prevention. That's where most occupational therapists see themselves. But there is no reason that we can't be involved in the primary and secondary levels of prevention. So as we explore prevention in occupational therapy, let's define preventative occupation. It is the application of occupational science in the prevention of disease and disability and the promotion of health and well-being of individuals and communities through meaningful engagement in occupations. This really sounds a lot like our vision statement, doesn't it? An example of preventative occupation is defined within Chapter 2. Please read a little further about the Well Elderly Study. This is a perfect example of occupational therapy's role in preventative occupation. Goals of health promotion and prevention include to prevent or reduce the incidence of illness or disease, accident, injuries, and disabilities within a population, to reduce health disparities among racial and ethnic minorities and other underserved populations, enhance mental health, resiliency, and the quality of life of individuals, and to prevent secondary conditions and improve the overall health and well-being of people with chronic conditions or disabilities and their caregivers. And finally, to promote healthy living practices, social participation, occupational justice, and healthy communities with respect for cross-cultural issues and concerns. And this is defined by AOTA 2013. The role of OT in community and population health can include and should include promote healthy lifestyles for all, infusing occupation into existing health promotion programs and activities, develop and implement occupation-based community and population health promotion interventions targeting a variety of constituencies, including individuals, both with and without disabilities, groups, organizations, communities, populations, and governmental policies. So let's look at the intervention levels. On an organizational level for intervention, an example may include disability awareness training for service industry personnel, such as those who may work for an airline, hotel, or restaurant. A community-level intervention includes staff and volunteer training for special needs shelters during a disaster. A population-level intervention may include the implementation of depression screening program for new mothers for the purpose of developing prevention and early intervention programs. And then governmental policy interventions may include the promotion of barrier-free universal design environments to enable full community participation for persons of all ages and abilities. Within this chapter, you will learn more about community-centered practice framework. This framework identifies, first of all, the community. It explores community occupations. It assesses the community resources and barriers. And then it implements strategies for participation enablement. So let's go over a real-life example. A brand new elementary school is open that supports a local diverse community. The school has students that speak 16 languages and includes many immigrants and refugees. The new school did not have a playground when it opened. The school-based occupational therapist jumped into action. The OT practitioners collaborated with local OT student volunteers to paint sidewalk games until the playground could be built. The solution gave play space until the playground would open in 6 months. So, what concepts and principles did the OT apply in this example? What level of prevention do you think this is? And how does this enact the concepts of health promotion? What community occupations does this support? Ponder those questions and maybe consider that when we discuss, have our discussion forum for this particular unit. So in summary, community and population health should focus on community-centered framework, infusing the values of prevention, health promotion, population health, and community occupations. Thank you for listening to this lecture. For citations and references, please see the references at the end of Chapter 2 for this week's unit. Thank you so much.